Good morning, I'm Lauren from Migraine Australia, and today I'm interviewing Dr. Stephanie Goodhew, who's going to share her research. Stephanie, could you please tell us about your research?
Good morning. So my background in research is in the area of visual attention. So I'm particularly interested in the mechanisms that underlie the performance of complex visual tasks, so things like driving, for example. More recently, I've sort of branched out and been using the skills I've developed in those areas and applying them to understanding migraine. I'm particularly interested in sort of two aspects. One is the public health perspective. So what do people know about migraine, its diagnostic features, the treatments available, and how can we maybe correct some misconceptions and get more information and awareness out there. And the other is understanding the psychological impact of migraine on sufferers.
So what would you say that you're trying to achieve with your research? What's the end goal?
One of my primary goals is to reduce suffering. So I think that it's quite common for people to suffer in silence and to not access available treatments. And of course, different treatments are suitable for different people. Pharmaceuticals aren't necessarily the right approach for everybody, but I think that people deserve to know what's available so that they can make an informed choice. So I think disseminating information about migraine diagnosis and treatment is really, really important so that people don't go for long periods of time without accessing the treatment that could help them.
Where are you up to in your research?
Yeah, so I've got a couple of projects going on. So one completed last year and published was looking at levels of what I call migraine literacy, so how knowledgeable people were about migraine and its various features. Looked at people both who suffer from them and people who don't. And basically this identified some significant gaps in people's knowledge, and the idea there is that could provide a framework or a springboard for public health campaigns to try and rectify those gaps in knowledge.
Whereabouts are you up to on the mental health side of things?
Yeah, so I've got a project currently underway looking at how migraine impacts people's everyday functioning, from things like how they pay attention to tasks to how it affects their memory, both during attacks but also not during attacks. And yeah, I'd really like to do, or sort of planned in the works, is a larger scale study looking at the prevalence of migraine in Australia and its impact on sort of a host of physical and psychological variables.
Yeah, amazing. So what can people with migraine do to help?
So I think there's two important ways that people can really contribute if they'd like to. One is, I think it can be a tough ask, is to really be a migraine ambassador if you're a sufferer. So this means taking opportunities to sort of share information about the condition and how it impacts you with friends and family and things like that when it comes up in conversation. And that, I understand that can be really tough, especially if you do come up against maybe misconceptions and misunderstandings. But it can be a really great opportunity to sort of at that more micro level get the right information out there. And the second thing, if people are willing and happy, is to participate in migraine research, because the more information that we gather, the better we can understand this condition. And information can also be really important to impact things like public policy. So the more high quality data that we have about how extensive this condition might be and how it impacts so many Australians, that can be leveraged to influence on public policy.
And in terms of public policy, where would you say general understanding is?
Yeah, I think general understanding is a lot lower for migraine than it is for a number of other conditions. I think that's an area we could really do some good in.
So with your research, especially on the mental health side of things, if you're someone who has migraines, how can they apply your research to maybe make things a bit brighter?
Well, my research doesn't speak to that directly, but what I'd really encourage people is to access the resources that are available. So both the impact that it has on your physical health, so talking to your doctor, potentially referral to a neurologist, but there are documented associations between migraine and mental health issues, and so treating those can be really important as well to improve people's quality of life.
So a lot of what we're trying to achieve is not only more education for those with migraines, but people who have migraines but don't know they have migraines. So getting them to access healthcare and go, oh, actually, I don't have to have this horrible pain in my head, or I can do
Yeah,
something hopefully about it.
it's amazing when you talk to some people and they're like, oh yeah, I do get migraines. I've, to know there are any treatments available and things like that. It's just, yeah, there's so much, such a big gap in public awareness about it.
Yeah, the amount of times I've been talking to someone and my migraines will come up and they say, "Oh yeah, I get this really bad pain on the side of my head, or I get like spotty visions, or my head hurts and I throw up." And I'll say, "Yeah, that's a migraine. You should talk to your doctor."
Yeah, it's so strange, isn't it? I mean, there's so many other conditions. If you had
Mm,
epilepsy, for example, you would immediately go and access the care that you need. But for some reason, it sort of gets caught up in this, oh, it's just a headache idea, I think. And
yeah. Is there anything else you'd like to add or speak about?
I think we've pretty much covered everything. Yeah, just I suppose I'd emphasise the importance of knowledge and information, and being armed with that can be really important. I sort of subscribe to the view that healthcare should be a collaboration between healthcare professionals and the patient. And so I think the more information that a patient has, it can be really useful to sort of advocate for the level of care that they want and need.
Perfect. Thank you so much for your time this morning.
No problems. Thanks for chatting.
Oh.